Hey, everybody, welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices. And what we're doing here is getting educated. We're learning from some of the best and really getting to learn about different backgrounds, different perspectives, and getting good information to you. So, without further ado, I do have a really awesome special guest that I want to introduce you to. And his name is Dr. Christian Nelson. Hey, Dr. Christian. And he is the owner of Advocate Wellness in Texas. So, welcome, Dr. Nelson. Appreciate you coming on.
Thank you so much.
Yeah, I'm excited to dive in with you. I know we have a lot to cover, but something that I love to do here in the beginning, and I think it just gives such a good overall sense of who you are and how we're going to kick things off is learning about your origin story. Like what got you here? What made you want to open up your own practice and even get into your specialty?
For sure. So, chiropractic changed my life when I was a teenager. I was living in a lot of pain, and I had a near miraculous experience where I went from extreme pain to going home and sleeping for almost a day and a half to my second appointment. Somebody rolled in a wheelchair and walked out. So, I had the pleasure of seeing a really good doctor. I knew I wanted to be a doctor since I was a kid. I saw that. I was like, where do I sign up? And 11 years later, I graduated with my doctorate in chiropractic. But, my mom was an oncology nurse, and I grew up watching the medical system and then some of the more holistic things that she had grown into. And I was like, something's got to change. Like the person really needs to be seen and heard and valued. I saw the way the pediatrician had to rush. He loved spending time with us, but he had to rush. I knew that wasn't his choice. That was the way it worked. I was like, all right, so we got to find a way to where we can really focus on the person themselves and not rush. Like you got to be timely. You got to see people. You can't sit around and talk with two people all day. But take a moment to actually see the person in front of you. The doctor should see, and I mean see the patient. And so that's kind of where it started. It's like I wanted to really make sure that it's focused on the individual.
Yeah, that's so cool. I always love hearing a little bit about the background because I always find that people definitely have a personal story, a connection, whether it was them themselves that were injured or, trying to fix what was going on with them, or maybe had a great mentor or someone in the family that was in healthcare. And so it's so cool to see all of those things combined and connect to get to where you are today. So I always think people are definitely most passionate when they've been there themselves.
I agree. I've had classmates that had a transformational experience with chiropractic and those who did not. And there was a level of, and not that the ones who were doing it because it was a great job or a great career weren't good doctors,
Hmm.
but there was a level of passion and dedication and, dare I say, zeal.
Hmm.
The ones
Yeah,
who life transformed, they brought to the profession and they brought to their education and their training and their adjusting to the tune where some of them had, even in school, some of the most amazing hands I've ever experienced.
that is awesome. Yeah, I feel like, not that people have more skin in the game than others due to their experience, but you can definitely understand it at a different level. When you can understand the pain, you can understand the anxiety that comes with it. You can get real with your patients. So I think that's terrific. And kind of speaking about the pain, what what are people today really commonly experiencing? What are people truly struggling with right now?
Oh man, so many things. Let's keep it down to
Loaded
what I.
question.
So the things that people come to see me for the most are usually neck pain, headaches, jaw pain. I see a lot of low back pain cases, and then also neuropathy, diabetic. Sometimes it's post chemo, but diabetic neuropathy makes up the most of it. So burning, tingling, numbness, loss of balance, loss of sensation, lack of healing, and opportunistic infection in their feet.
Hmm. Yeah. Why do you think, I mean, obviously with cancer and other ailments, you can expect maybe some of those side effects, but do you think it's the way that we're living right now in this environment. It's 2025. There's a lot of technology. We're constantly like this, looking at our phone. Do you feel like more people are experiencing pain now than they were maybe in previous generations due to our lifestyles today?
I don't think so. But I do think that we're, as a rule, we've adapted downwards. We're more fragile. So they had more traumas to deal with, and they took harder hits in general. You read the accounts of what the farmers back in the day would have to deal with, the kind of hits they would take and just get back up, and then they didn't see anybody. They just worked. So I think in general they took harder hits, but they were more resilient. And I think we're not as resilient because of our environment. And we use technology, among other things, to make life easier on ourselves. But I think in general, we've become less capable and less resilient. So I think it's about the same. People love to blame phones and tech neck and everything else like that. But it turns out that most of your postural muscles run 90% on your sense of self-worth and your serotonin levels, and might have actually much more to do with your gut health than actually your back health, with one notable exception, and that is if it is too painful to straighten up. If
Ah,
that's the case, then a back adjustment will fix your posture. But if your lack of sense of self worth, sound it out, Christian, is really the primary problem, I can help adjust you. I can help give you probiotics. But there's some deeper work that needs to happen, maybe some therapy that needs to happen, some co-management between myself and another provider.
mhm.
Find that, and a lot of teens don't have a big track record, or they don't have things that they're super proud of, and so they might not be feeling very good about themselves, and as a result, they're slumping. But it was before the phones, it was the pulp fiction. Before that, it was the comics. Before that, it was the newspapers. And before that, it was playing Mumbledy Peg or, tic-tac-toe or whatever the case was. They'd all be all hunched over and like all playing together in little groups.
Yep. I love your perspective because I think there's always an excuse that can be made, right? And so I love breaking it down and actually giving evidence. Like, okay, before there was texting, there was comic books or just things that you were doing, reading, anything, just looking
Right.
down. So, there's all different things to say why, but I love your philosophy on it. I think that's super cool. And this is exactly why we do what we're doing is to bring new information. That's the first time I've ever heard that. We've been doing this for 5 years. We need new perspectives. And so that is super cool. And speaking of how your approach is different, what
Mm,
else would you say that you do or that you think that is different? Maybe amongst some people that you have worked with before, or maybe there's some modalities that are in your office that are really effective. And that is something that is different than, or maybe people don't even know about it. So maybe you could tell us maybe some things like the neuropathy or other things that you use in your office that are helpful to patients.
sure. I'm a chiropractor by training. So most people at this point, thanks to YouTube, Instagram, TikTok, know what certain adjustments might look like. Mine are less dramatic than the ones you might see there. But, you know, the amount of power correlate to the amount of effectiveness. They look dramatic and they're super fun to listen to on ASMR. So folks are divided. Sometimes they're like, oh, it feels so good just to watch someone get adjusted. And other people like, oh my God, ew, get that away from me. So you're either one camp or the other, I think. But the things that I really do that stands out that's not super well known is what's called red light therapy. It goes by lots of different names: low level laser therapy, cold laser, low level light therapy, red light therapy, infrared light therapy. Basically, the idea is to shine a frequency into the body that activates a receptor on the cell. The cell then responds and does the thing you want it to do. So, for instance, you can get the effects of taking an NSAID in that local area that you've shown the light on without any of the nasty side effects that can come with NSAIDs, for instance, the negative effects on the stomach, particularly, and some others. And so, if I want to help someone have a comfortable adjustment that's going to last a long time, I'll make sure that they get red light therapy to calm down the nerves, to increase the blood flow, to increase the ATP production from the mitochondria, which just makes the whole cellular area just be able to heal faster, adapt faster, and accept the input I give in the adjustment and maybe the muscle work. I'll do some of the stretches, work on it with a massage gun or some other form of percussion. Just get things loosened up. And I wouldn't say I'm famous for this, but yeah, it's about once or twice every week that someone will say, no one's been able to adjust that for me before. That's been stuck for, years, decades. How did you get that to let go? Oh, thank God that's finally moving again, because there'll be a crick in their neck or something stuck, or as my fellow Southerners like to say, there's a pinch right there that just hasn't been going away. And I'm able to get to it, calm down those nerves, relax those muscles, and then the joint is ripe to be adjusted. It's ready. It's actually ready, and it's no longer guarding itself so much. It's actually at a state where it's like, I could handle an adjustment, and not just handle it, but welcome it. And that's when you kick healing into a whole nother gear.
Yep. No, that's amazing. There's so many different technologies that are out there, and you read about things, which kind of goes into, my next question is that, the internet is helpful, but it can also be dangerous.
Yeah.
Not everything you read on there is real or true or half true. And
Yep.
then, you read things, couple lines later, you think you have cancer, or you have a worse thing than you really do have.
Yeah.
So that being said, there is so much out there. But it's cool to see and understand, at a base level, what this can do for you, how it's going to help your treatment. And what you did there is so helpful to all of us, and saying, yes, okay, like there's all these things that can be combined, but doing it the right way. So
Yeah.
that in a strategic way. So it's not like, oh, you just use the red light therapy and that's it, but it's combined with multiple things so that it is teed up to make everything else work
Sure.
properly.
When
So
it comes to neuropathy, for instance, let me say this.
yeah,
Let me just add this. There are two factors with it. So red light therapy by itself is phenomenally beneficial, and it's very, very safe.
mhm,
Especially at the levels that the devices are approved at by the FDA. The worst you can get is like a level 2 sunburn.
mhm.
Like, that's the worst I've seen as far as side effects go. And in the grand scheme of treatments and side effects, that's pretty tame. Like, put some lotion on it. Very sorry, it'll feel better. I haven't had it happen here in the office. I use lower power devices, but yeah. But there's something that needs to be addressed here in terms of dosage.
Yeah.
So if you go sit in an infrared sauna and you're getting that infrared, you need to understand that how close the emitter is, how close the light source is to your body depends drastically on how much of that you absorb. So I can take, for instance, a powerful, small, cold laser. So it's called cold because it doesn't like run hot like you would cut paper out with something, right?
Yeah.
It's just at max, it's warm.
Mhm.
And shine it on, like, let's say a joint.
Sure.
And all of those photons to hit the joint. If you go into a sauna, you have this big emitter, but it's
Mhm.
all spread out. And the distance from you means that it's spread out not just linearly, but exponentially more.
Right.
So if you go sit in an infrared sauna, you could get some benefits. You can get whole body benefits that you might love. It might help with sleep. It might help with relaxation, stress, blood flow, anti-aging effects on the skin, all very well documented effects. But if you're trying to treat like a joint, or you're trying to specifically treat your feet, say in the case of neuropathy,
Yeah.
you're going to want it more focused.
Yeah.
That allows dosage to increase, again, on the positive side, exponentially more effective. And so if someone's like, I've tried red light therapy before, they may have. But you
Yeah.
need to, at that distance, really, the power setting that the device is capable of and the distance from light to target makes
Mhm.
a huge difference.
Yeah, that's crazy. I think most people wouldn't know that, going into it, and definitely, maybe they have before, or maybe they've been in an infrared sauna, so they're like, oh yeah, I've done red light, but you're right. You're not targeting, your target well. So you might not be getting the full benefits and you might be throwing away a great path and modality for you, when in fact it just wasn't done well to be effective. So,
Broad, you get a broad application, so you're going to have broad general effects. If you
mhm.
want specific benefits, you need a specific application.
Yep. 100%. I love that. And kind of, diving back, you've given so many great tips and even debunked already some myths, I think, for a lot of us. But, in the spirit of things, I love talking about it because you have such a great perspective. And so I kind of want to dive in more because I'm sure there are questions that you receive maybe on a weekly basis of some misconceptions about what you do, how you do it. Like I said, people read things on the internet. It's great that they are trying to be invested in their health. So A plus for, being invested and trying to do research, but it may not be the research that you need or the answers that you need, and they just might be completely false. So, and all that, what are some of the things that you feel like you are constantly debunking?
Mm. I think the most common one is that popping your knuckles or popping your joints. You'll see people do it, that it'll give you arthritis or that it's somehow a bad thing. And I tell people, no, no, that's not true at all. If you look at the evidence, it's very clear that the popping of the joints doesn't cause arthritis. It's nothing bad. It just means that joints are moving.
Yeah.
Crunch when a body hits the ground and it's a bad thing. Those are the joints moving in a bad way. But then
Yeah.
they crunch on my table when I'm putting them back to moving the way they're supposed to. It's not that the crunch is good or bad, it's just movement. And
Hmm.
kind of to reference back to earlier, the good adjustment needs to be specifically applied. If you have somebody with a viral TikTok video where there's like a million crunches,
Yeah.
okay, some people adjust easier than others. Some people carry less or more tension than others. And so it doesn't necessarily mean the adjustment was better for them. And it doesn't necessarily mean that they were in a worse place. In fact, the most effective adjustments for the people who are feeling the worst usually sound like a click, not even a crack or a crunch or a pop or anything like that. To get those noises, they have to be relaxed. And usually they come in just absolutely like locked up. So yeah, popping your joints is not bad for you. Popping your own neck, unless you have a bone softening disease, is safe. You probably won't get lasting relief from it. So you should probably see someone who can adjust that problem joint for you.
Yep.
But like popping it for yourself, it doesn't hurt. It doesn't help as much as we wish it did, but it doesn't hurt.
It's great that you're talking about this because obviously, as we said, people are looking at online, people
Yeah.
are scrolling through TikTok or Instagram, and some of the things are sensationalized, but then you also just don't know what's true or what to expect. And so you're just kind of left wondering, is this really how it is? And then that creates all the questions, which you just answered. So,
Yeah. Yep. Yep. And the other one is you don't have to be beautifully gorgeous and dressed in athleisure to get adjusted. Don't believe what the videos tell you. Like you can, normal people get adjusted too, not just fitness influencers.
yeah, I mean, I feel like, everyone should try something new in their life, whether they've been or not been, or like how we talked about earlier, you may have been exposed to something that wasn't done in the best way for you in the way that you needed it. So, there's always second opinions out there. So I always say, ask the questions, be curious about your health. So this is really fantastic and kind of the way I'd love to leave off today just because you've done such a great job of it. And something that I always like to get from providers is it's kind of a two-pronged question here. So
Okay.
this is for providers and this is also for patients. So I'd love pro tips for both people. So one way for the everyday person, what is something that we can do either on a daily basis or start today that's super easy to just move our health in a better trajectory now? And then for providers, you have really great perspective. You're very honest, you're straight to the point. Providers have questions too. Owning private practices is not easy.
Jesus, no.
No. So you're often asking different questions. So for you, I would love if you could give some of the providers that are listening a pro tip on something that maybe that's helped you in your business, something that that you maybe do every day, whether that's, a technology that you use or it has to do with something in the way that you treat patients that you're like, man, this is a game changer. Wish I would have started this day one. So without further ado, would love all the pro tips that you
Yes,
do.
for sure. For people at home, everyday folks, I actually want to give two tips if that's okay.
Two tips.
The first one is remember that the truth doesn't mind being questioned. And so if your provider or your doctor or anyone in your healthcare team gets defensive when you're curious, that's a red flag. You might choose to end the relationship with that provider over that, or you might bring it to their attention if you think they might be receptive and be like, hey, I'm just trying to understand how this works. Why are you getting defensive? The truth should not mind being questioned. And so it might just be that they don't understand it as well as they think they do. It could be that they're running short on time. It could be that they're embarrassed, that they forgot something, or they're just blanking. And so or they've been taught by some other numbskull that this is just what you say when patients ask you pesky questions. But no, have your questions, be curious.
Mm.
And remember, the truth doesn't mind being questioned. Okay. So if somebody gets defensive, that's a flag and it's not your fault.
Mm. I
Okay.
love that.
The second thing is take care of your muscles. You can find and get rid of trigger points. If you look up trigger point referral, you put that in your Google search bar right now, pause this video, go look at that. You will see pain that refers along the muscles and along the fascia, sometimes as far as 18 to 24 inches away from the trigger point itself. And removing trigger points is pretty easy with a lacrosse ball and some deep breathing. I actually have a free training video on this on my YouTube channel, which we'll make sure everybody can get to later. Takes about 7 minutes to watch, pretty straightforward. And you can get rid of a lot of the pain and a lot of the tightness in your body and make yourself less injury prone. If, let's say, I have these 8 bands of muscle in a muscle, but two of them are like really tight and trigger pointed, they're the ones that are going to be engaged first if you move funny or have to catch yourself. And they're the ones that are really painful. And then your body's going to twitch or like move in some sort of unnatural manner. So say you step off the curb funny, you just miss something, you almost roll your ankle and you're trying to catch yourself. If there are trigger points in your glutes, your hips won't react properly and you'll have trouble gaining your balance. On top of tweaking your hip, you might also fall down and have to deal with those impacts. And if you had found and removed the trigger points first, it only takes 5 minutes a day and it's all it costs you is a lacrosse ball. Yeah, you could have avoided all of that. You could have stayed at my office or one of my colleagues' offices, or maybe avoided, a hospital visit if you broke a bone. And so there's a lot you can do preventatively that helps keep you injury free, and stuff that just slowly builds up. We're not too dissimilar from a car. If you don't do your preventative maintenance, it's
You're gonna
going
have problems.
to do your preventative maintenance, and it only takes 5 minutes a day. So that's super easy to do.
I
Uh,
love it. I mean,
yeah,
those are great pieces of advice. I mean, we always talk about treating the problem, getting to the root cause of the problem, but also let's talk about the preventative measures that you can take. And I love that I mean, yes, I would love to see you as a patient. I'll love to help you, but I don't want to see you here either. I'm happy to give you some things to help you along the way, right?
my goal as a chiropractor is to work myself out of a job to where
Yep.
you're only coming to see me for the equivalent of tires, gas, and oil. Like
Yep.
just the things that the car needs kind of no matter what. But if I've done my job correctly, you are taking care of the vast majority of stuff by yourself. I
Yep.
want you for tuning up and optimizing your nervous system long term. Short term, yeah, we're gonna dive in. We're gonna do some work. We're gonna get you taken care of. But yeah, long term, I want to empower people. It's a revolution of sorts in the healthcare space that I'm helping lead. You could call it a counterinsurgency, where it's like, no, we're taking our power back. Thank you very much.
I love that. I mean, all this has been amazing, and would also love to hear though the pro before we leave off today,
Yeah.
pro tip for providers, because if this is just as good as patients. I know the providers are going to want to be listening in and hearing what kind of pro tips you have for them.
Sure, sure. Two things, and I'll keep this one brief because I know we're running short. For the providers listening, The Speed of Trust is probably the best book that I have ever encountered as far as being able to build, maintain, and repair trust with the patient. If the patient doesn't trust the doctor, they will be resistant to all of your recommendations and they won't follow through on your homework. And then they won't get the benefits and then they won't get well. And then they'll come around and leave you a nasty Google review that Dr. So and so didn't fix me or Dr. So and so. It's like, it's not fair to you.
Mm.
But you got to do the work on the front end to establish, maintain, and repair trust if it's broken. And The Speed of Trust by Stephen M.R. Covey is hands down one of the most amazing books. It's my top 5 to recommend to anyone. And if your patients trust you, they will love you, they will refer to you. So speaking of building a practice, if you know how to communicate with them, you know how to meet their needs, they will love you forever. And the second tip is one that I was given when I was in school, is make sure that you schedule time to listen to your patients. If you're running so fast that you don't have time to listen to them, you find yourself cutting them off, you find yourself interrupting them. First off, you're going to lose trust, you're going to lose efficacy, you're going to lose follow through, you're going to lose, from a business perspective, also revenue and referrals. And there's going to be huge opportunity cost. You're not going to have the reputation you could have in your community for being, Mr. Rogers said, look for the helpers. You're going to miss out on being one of those people to a lot of other folks because you took 30 seconds less. Let them finish their sentence.
Mm.
Patients will give you 90% of the diagnosis if you will just shut up. Be a
I,
little rash about it, but that's the fact. I'll give you 90% of it.
yeah, no, I love that. You threw out, I love the one-liners though. Throwing in Mr. Rogers, total classic, right? True. Yeah. Amazing, right?
Yeah.
But true. I think in this world we often move too fast. We want to skip to the end and we miss everything in between, and that really doesn't help anybody, including yourself. And so yeah, it resonated with me. I don't know if you noticed, I just sat back and I was like, yes, I'm listening to you. Like, this is fantastic. This is great advice that practitioners, everyone needs, is just you need to schedule time to listen and know what's happening. So this has been fantastic. So, Christian, this has been such a great experience. I loved having you on. We hope to have you on again. But right before we leave off, if you can just tell everyone where they can find you, where they could reach out, any of the cool platforms that you're on, that you're doing all these great videos, please feel free to share with us.
Of course. So you can find me on YouTube, Instagram, and Facebook. The handle is all the same, Advocate Wellness TX. Can we link that in the show notes? Okay, cool. That'll be down in the description or in the show notes down below. And then if you want to look at my website and learn more about my healing approach, it's keller-chiro.com. And yes, I'm able to help people long distance with nutritional or lifestyle advice. So if you can access the internet and you can do a video call with me, you can totally book a consult or a new patient exam with me. And I'll reach out to you ahead of time, spend a little time with you on the phone, figure out what you're trying to get to. And if at any point I feel like someone else is a better fit for your care, I'll tell you exactly who that is. And for any providers who are looking for questions or guidance, I'm happy to connect you with some of the resources that have helped me build and grow my practice into something that I am just absolutely excited to go to every day.
Awesome. Well, thank you so much for being here, and we really do hope to have you on again.
I'd be delighted.
Thanks so much.